Hello, hello. Good morning or evening, everyone, depending on where you are, in what time zone. Excellencies, esteemed delegates, guests, welcome to this virtual high-level discussion on the road to 2023 kickoff of the high-level meeting on universal health coverage. I'm truly honored today to moderate this event as a member of the UHC Movement Political Advisory Panel, which is a group of eminent high-level champions of UHC. This panel was established to support political advocacy of the movement in critical milestones towards 2023. If you allow me a couple of housekeeping before we get started, I have to tell you that we have simultaneous interpretation in Arabic, English, French, and Spanish. And please, you can change the language to your preference using the globe button at the bottom right of your screen. And please make full use also of the Q&A box, and our speakers and technical experts will do their best to answer thoroughly throughout the event. We have today a full and very ambitious, very exciting program, and therefore I kindly request our speakers to adhere to the allotted time so we can hear from everyone today. And finally, before we get started, let me draw your attention to the chat, where we have shared some hashtags on UHC Day 2021 campaign. There are some materials and co-host Twitter accounts. So please, social media participation is highly, highly welcomed. As we embarked on the 76th session of the UN General Assembly, we mark the halfway point between 2019 high-level meeting on UHC and the upcoming high-level meeting on UHC in 2023, for which member states have just adopted the modalities. So when we concluded the high-level meeting in 2019, we did not know just how urgent the call for UHC would be. Still, we knew that over half of the world's population lacked access to essential health services, and approximately 100 million people were being pushed into poverty every year as a result of unaffordable healthcare. We knew that access to health services needed to be more equitable and that progress needed to be accelerated in order to meet our targets. COVID-19 has compounded these gaps and challenges. For the first time since the adoption of the Sustainable Development Agenda in 2015, progress on the SDGs has reversed. As we fall further behind than 2019, how can we scale up our resources and actions to achieve our 2030 goals? I challenge us to use the pandemic to build back stronger. COVID-19 has exposed the weakness in our health systems, and in addressing this unprecedented challenge, we have seen success in accelerated actions, increased investments, expanded collaboration, and innovation necessary to provide robust public health measures and secure testing, treatment, and care. We have witnessed the devastating impact of complacency and underinvestment, but we have also seen firsthand where our efforts need to be focused. The 2019 political declaration is a great blueprint, but now we must strengthen it further. We must leave ourselves better prepared for the next crisis. The upcoming high-level meeting in 2023 is an opportune moment to align efforts and translate political commitment into true action. I invite today's panelists to join me in this dialogue to pave the way to 2023. Together, we can make this moment impactful. It is now my pleasure to turn the floor over to our co-hosts and steadfast champions of UHC on the international stage. The co-chair of the Group of Friends of Universal Health Coverage, represented today by the esteemed ministers from Thailand, Japan, and Georgia. Allow me to first introduce a video message from His Excellency Mr. Don Pramudianai, Deputy Prime Minister and Minister of Foreign Affairs of the Kingdom of Thailand. Please, let's watch this message.
Co-chairs, Mr. Secretary General, Director General of the WHO, Excellencies, ladies and gentlemen. As we are at midway to 2023, this high-level side event is indeed timely form to reflect on the political declaration on universal health coverage and our progress on UHC. We have only 2 years ahead of us until the next level meeting on UHC, but we find ourselves here today still in the midst of a pandemic that has severely tested the rule books and capacity of our national and global healthcare systems. Indeed, COVID-19 is a thunderbolt that disrupts and destroys. It is a detriment not only to our health, but also to our social, economic, and political well-being at the same time. It heightens our awareness that we need to redouble our effort in our drive to a better health system that are inclusive, affordable, accessible, and sustainable. The independent panel for pandemic preparedness and response has also pointed to the critical role of UHC in preventing future pandemics. There are 3 key areas that require our immediate attention if we are to be better prepared to take on the next pandemic and to realize UHC. First, it must do more to promote equitable, affordable, timely, and universal access to vaccines and medicines. More capacity building, knowledge sharing, and technology transfer could help scale up production of vaccines, medicines, and medical supplies. This is needed not only at the global level, but more critically at regional levels. These global public goods cannot be in short supply, but they in fact were. Second, we need to tackle the problem of underinvestment in healthcare infrastructures and services. This is a major obstacle to achieving UHC around the world. The global economic disruption has only exacerbated this problem. Therefore, we must do our utmost in strengthening global medical health financing mechanism, and priorities should be given to helping our countries most in need. Third, UHC must be highlighted as part of post-COVID-19 response strategies. As we plan for a future in which we are better prepared and equipped against future emerging pandemic, Thailand shall work to ensure that UHC is an important part of international conversations. This includes discussions of the pandemic treaty. Excellency and colleagues, what the challenges mentioned earlier dictate that we must continue our unwavering commitment and dedication towards implementation of 2019 political declaration for the UN high-level meeting on universal health coverage. Health security is a basic human right. Hence, effort is humanitarian and a matter of life and death. As such, apathy is not and must not be an option. Thank you very much.
Thank you very much, Excellency, and thank you for the unwavering commitment of the Kingdom of Thailand to the UHC agenda. Let me immediately introduce the video message from His Excellency Toshimitsu Motegi, Minister of Foreign Affairs of Japan. So please, very eager to hear the minister's message.
現在世界では新型コロナ感染症の克服に加え、将来のパンデミックへの備えが求められています。これはまさにユニバーサルヘルスカバレッジの達成に向けた取り組みを通じて達成されるものであり、我々は新型コロナの教訓を共有しながら一貫した取り組みを進める必要があります。日本は本年6月にCOVAXワクチンサミットを共催し、合計10億ドルの拠出を表明したほか、世界第3位となる2300万回分のワクチンの現物供与を行ってきました。今後、合計6000万回分をめどとしてワクチンを供与するとともに、ワクチンを一人一人に確実に届けるためのラストワンマイル支援も引き続き進めていきます。また、将来の感染症への備えとして、関係者間で教訓を共有し、連携しながら保健システムの強化を進めることも必要です。ポストコロナの新しい時代には、より強靭な UHC の達成が求められています。さらに、保健分野にとどまらない幅広い分野での連携も必要です。その一環として、本年12月には、新型コロナによって深刻化する世界的な栄養不良に対応するため、日本は東京栄養サミットを主催して、世界的な取り組みを加速化していきます。国連 USC ハイレベル会合が開催される2023年は、日本が G7 議長国を務めます。本日ご参加の皆様や、さまざまな国際機関、国際フォーラムと緊密に連携し、USC の達成に向け、日本としてリーダーシップを発揮していきます。ありがとうございました。
Thank you, Minister Motegi, for the leadership of your country with regard to the UHC agenda. Your leadership has really made a difference. So thank you very much to Japan and Minister Motegi. I immediately give the floor to Ms. Tamar Gabunia, First Deputy Minister of Internally Displaced Persons from the Occupied Territories, Labor, Health and Social Affairs of Georgia. You have the floor, Excellency.
Thank you so much, dear Chair, Co-Chairs, Director General, distinguished delegates. It's my honor to address you on behalf of the Ministry of Health of Georgia. 2030 is approaching fast, and it's very timely to analyze progress and discuss how to accelerate movement towards UHC goals. Back in 2019, countries recommitted to achieve universal health coverage by 2030. Many countries, including Georgia, set very ambitious goals for strengthening health systems and eliminating disparities in access to quality health services, safe and effective drugs and vaccines. The onset of COVID-19 has posed critical challenges to health systems. Over the last 2 years, we had to respond to and prevent severe damage caused by a rapidly spreading infectious disease while maintaining other essential health services. Indeed, we've been operating in a very complex economic, social, and healthcare environment. However, the urgency and importance of addressing COVID-19 related threats stimulated developmental efforts at national, regional, and global levels. The pandemic shows us again how important it is to make health systems truly resilient to health emergencies by investing in public health infrastructure and strengthening health security programs. Over the last 2 years, we've observed a very strong interconnection and synergies between health security and UHC policies and interventions. Our efforts were dual, address the deadly consequences of pandemic on the one hand, and maintaining uninterrupted access to essential services on the other. Besides all the challenges, COVID opened up a new window of opportunity for positive policy reforms towards achieving SDG goals by 2030. By taking advantage of these opportunities, Georgia made very rapid progress for building primary care infrastructure, upgrading state-owned hospitals, strengthening capacity of family doctors and critical care providers, introducing telemedicine and digital solutions for eliminating access barriers, rolling out new diagnostic technologies. Very strong multi-sectoral coordination was established during the COVID crisis that has served as a platform for revisiting and fine-tuning UHC agenda and mobilizing additional resources for strengthening primary healthcare system, building community-based mental health services, and advancing communicable, non-communicable disease surveillance programs. We consider good coordination and partnership among state and civil society actors, as well as support provided by donor and bilateral partners as one of the critical success factors on our journey towards achieving UHC goals. Georgia remains committed to global movements towards UNG and would be happy to continuously work with all partners for building truly equitable and resilient health systems nationally, in the region, and globally. I thank you for your attention.
We have to thank you, Minister Gabunia. Thank you for the commitment of Georgia to the UHC agenda and for your incredible leadership of your group of friends as well. It's great to have you among us today. I would immediately give the floor, and I have the pleasure to give the floor to Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, for opening remarks and a closer look at health systems strengthening for UHC. You have the floor, Dr. Tedros, and we are privileged to have you here today with us.
Thank you. Thank you so much, Your Excellency María Fernanda Espinosa. And very nice to see you, my sister. And Excellencies, thank you. Muchas gracias. Excellencies, esteemed colleagues, first, my thanks to the co-chairs of the group of friends of UHC, Thailand, Japan, and Georgia for their continued leadership, and our other co-sponsors for convening today's event. Thank you so much indeed. The COVID-19 pandemic is a powerful demonstration that when health is at risk, everything is at risk, which is why the task force, the task of supporting countries to progress toward this UHC is more urgent than ever and more possible than ever. So I would like to give you 3 priorities. Given I have 3 minutes, I need to quickly put the 3 ideas. First, we have to end the pandemic and the disruption it is causing to health systems, societies, and economies. We seek the support of all member states and partners to vaccinate 40% of the population of every country by the end of this year and 70% by the middle of next year. Second, we must strengthen the global health architecture. We seek the support of all member states and partners for an international agreement on pandemic preparedness, which will be discussed at a special session of the World Health Assembly in November. Instead of the chaos and confusion that has fueled this pandemic, we need cooperation and collaboration in the face of common threats. That's why the pandemic treaty or agreement is crucial. And third, we must support all countries to invest in strengthening the foundations of their health systems, and especially primary health care. I'm more convinced than ever of the essential value of primary health care as a first-line defense against outbreaks and for promoting health, addressing the full spectrum of communicable and non-communicable diseases, and reducing the inequalities and inequities. WHO remains committed to working with our multilateral partners through the Global Action Plan for Healthy Lives and Well-being for All to support countries to achieve an equitable and resilient recovery and to drive progress towards UHC and the other health-related goals by 2030. At the same time, we must recognize that many of the reasons people get sick and die lie outside the health sector, which is why we must foster a whole of government and whole of society approach to address the social, environmental, and economic determinants of health, including human rights, gender equality, and the existential challenge of climate change. And the attendance of foreign ministers from Thailand and Japan shows that the health is not just left to the health sector alone. Achieving UHC by 2030 may seem an impossible dream, but as you all know, it always seems impossible until it is done, as Madiba Mandela said. So I thank you, and back to you, Madam Chair.
Thank you so much, Dr. Tedros. We heard loud and clear, we need to vaccinate 40% of the world's population by 2021 and 70% by mid-2022. And that's an achievable goal. We heard as well your call for the need to strengthen our global health governance with human rights and gender equality at the center. So thank you, Dr. Tedros, for your leadership and guidance, and thank you for being here for this very important kickoff as we prepare for the 2023 Universal Health Coverage high-level event. So thank you very much. I immediately would like to turn to give the floor to Her Excellency Ms. Amina Mohammed, Deputy Secretary General of the United Nations. She is going to be with us through a video message. So DSG, you have the floor. Looking forward to listening to your video message.
Excellencies, dear colleagues, ladies and gentlemen, this meeting marks the 2-year anniversary of the 2019 high-level meeting on universal health coverage, when heads of state from around the world recognized that universal health coverage is fundamental to achieving the Sustainable Development Goals and committed to accelerating progress. Even before the COVID-19 pandemic, we were not on track to achieve the UHC targets for 2030. Since then, we have witnessed the tragic consequences of this crisis on individual lives and on our development. Illness and death, over 100 million people pushed back into extreme poverty, a dire impact on mental health, lost education, reversal of progress on gender equality, reduced access to other health services, including those for sexual and reproductive health, and an increase in domestic violence, child marriage, and unpaid work. The need for universal health coverage has become more urgent than ever. Accelerating joint action on universal health coverage, climate change, and transforming food systems must be essential elements of all COVID-19 recovery plans. This will help to build stronger, more resilient communities and societies, and is central to preventing and dealing with future pandemics. We can only succeed through a combination of national action and multilateral cooperation. Platforms, including the SDG 3 Global Action Plan, with its focus on every woman, every child, and primary health care, and UHC 2030, can help coordinate approaches and maximize impact. Today, let us commit to bold measures and strengthen our cooperation. Our high-level meeting in 2023 must be a celebration of progress towards an equitable and resilient recovery, universal health coverage, and the entire 2030 Agenda for Sustainable Development. Thank you.
Thank you, dear sister Amina Mohammed, Deputy Secretary General of the United Nations, for your encouraging message. Thank you, Excellencies, all of you, all the panelists, for your opening remarks. I would now like to invite our co-sponsors to share their experiences, their priorities and efforts towards universal health coverage. So allow me to introduce His Excellency Dr. Frank Anthony, Minister of Health of the Cooperative Republic of Guyana and co-facilitator of the 2023 UHC High-Level Meeting Modalities Resolution. I invite Your Excellency to share with us brief remarks on the intergovernmental role to promote UHC and efforts to translate this into national policy. You have the floor, Excellency.
Thank you very much, Madam Chair, Dr. Tedros, colleague ministers, panelists, ladies and gentlemen. Achieving universal health coverage, where all people have access to health services they need, when and where they need them, without financial hardship, is critical to realizing the Sustainable Development Goals. The high-level meeting on universal health coverage held in 2019 offered governments and other stakeholders the first significant opportunity on the international stage to discuss UHC and to devise methods of achieving it. The political declaration, which was approved by consensus at the meeting, is the most comprehensive set of health commitments ever adopted by countries across the world. However, while impressive and ambitious on paper, it is imperative that we also track the progress made on its implementation. For Guyana, the 2019 political declaration continues to be an invaluable reference point as we strengthen our health systems and craft new health strategy for the 2021-2030 period, which will focus on the full enjoyment of a full range of essential services, from health promotion to prevention, treatment, rehabilitation, and palliative care. Like many countries, Guyana is experiencing an epidemiological transition towards non-communicable diseases. These diseases account for an increase in morbidity and mortality. And like the rest of the world, we are also adjusting to the impacts of the COVID-19 pandemic. These changing needs require adaptation and evolution of our health system. An essential element of the 2019 political declaration was an invitation to increase the engagement of actors across sectors, from governments to the UN developmental system, civil society and private sector entities. Governments pledge to leverage the full potential of the multilateral system to assist and support countries in their efforts to achieve universal health coverage at the national level. Indeed, our collaboration with health partners have been critical to advancing our health agenda for Guyana. For example, the UHC partnership, we have developed our National Human Resource Plan to expand health services delivery and to create health benefits, among other activities. We look forward to the follow-up high-level meeting in 2023, which will allow governments and other stakeholders the opportunity to undertake a comprehensive review on the implementation of the 2019 political declaration and to identify gaps and solutions towards the achievement of UHC by 2030. It will also allow us the opportunity of sharing experiences and best practices, alignment of goals, and creating collaborative partnerships, which are extremely important for smaller countries with limited resources. Madam Chair, the 2023 meeting is especially significant because it comes on the heels of a pandemic that has tested health systems across the world. COVID-19 has demonstrated forcefully that health systems do not exist in a vacuum. Our global goals require political commitment, national implementation, and international coordination to ensure good health for all and ultimately global health security. Domestic and international financing efforts must also be aligned to foster physical space needed to advance immediate COVID-19 response and recovery, and ultimately to achieve the SDGs. Recently, Guyana's permanent representative to the United Nations served as a co-facilitator for UHC 2023 modalities resolution. Member states were very active in the negotiation and ensuring that the stage is set for all relevant stakeholders to be at the table in 2023 and for another consensual, ambitious political declaration. Such participation and interest augurs well for the continued engagement of member states as we travel the road to UHC 2023. Indeed, we can expect spirited discussions during the negotiations for the 2023 political declaration. Guyana looks forward to the high-level meeting and engagement that we will have en route to the 2023 as we collectively examine the impact of the pandemic and discuss actions needed to build stronger and more resilient health systems and ultimately to achieve universal health coverage. I thank you, Madam Chair.
We have to thank you, Minister Anthony, for the commitment of your country with the motto Health for All, and congratulations for a successful adoption of the modalities resolution for the 2023 high-level meeting on UHC. I would immediately turn to His Excellency, Mr. Alexei Tsoy, Minister of Healthcare of the Republic of Kazakhstan, for brief remarks on the role of primary healthcare to achieve universal health coverage. You have the floor, Excellency.
Dear Madam Chair, Dr. Tedros, Excellencies, colleagues, I would like to thank hosts of the side event, the Road to 2023, kick off the high-level meeting on universal health coverage, including Georgia, Japan, Thailand, the World Health Organization, and UHC 2030 for organizing the event and inviting Kazakhstan to co-sponsor it. UN member states' commitment to support universal health coverage and achieve it by 2030 becomes increasingly challenging and crucially important during the COVID-19 pandemic. At the root of the UHC is the principle that the entire population should have access to quality healthcare services that they need without experiencing any financial difficulties. As indicated in the WHO's declaration of Astana, primary health care is a cornerstone of a sustainable health system for universal health coverage and health-related sustainable development goals. Additionally, PHC is the pillar of UHC in emergencies, ensuring the continuum of care and the provision of essential health services in line with humanitarian principles. Accordingly, the COVID-19 pandemic highlighted the increasing importance of primary health care. It remains one of the key pandemic response measures and simultaneously provides population with access to essential health services. Kazakhstan is the birthplace of primary health care, where countries adopted both the historical declaration of Alma-Ata and its successor, the Declaration of Astana on PHC. Member states have reaffirmed the commitment to the fundamental rights of every human being to the enjoyment of the highest attainable standards of health without distinction of any kind. Furthermore, countries have accepted the operational framework on PHC that provides countries with 14 levers to strengthen PHC at the national level. Moreover, the President of the Republic of Kazakhstan, Kassym-Jomart Tokayev, during the 73rd World Health Assembly in May 2021, indicated that the WHO European Center for PHC, located in Kazakhstan, should become a center for development and transfer of the best practices in primary health care on the global level. Once again, Let us emphasize and gratitude for organizers of the side event and wish all of us productive discussion. Thank you for your attention.
Thank you, Minister Tsoe, for making the case on the importance of primary health care as a basis to achieve a universal health coverage. And thank you to Kazakhstan for its commitment as well. I will immediately turn and give the floor to Her Excellency, Dr. Hanan Mohammed Al-Kawari, Minister of Public Health of the State of Qatar. She will provide us with remarks on the critical issue of the connections between the global health security agenda and UHC. You have the floor, Excellency.
Madam Chairperson, Your Excellencies, ladies and gentlemen, I'm pleased to make the statement on behalf of the group of friends of Solidarity for Global Health Security that has a membership of 48 states from all regions of the world, in addition to the European Union. I thank the co-chairs of the group of Friends of Universal Health Coverage, namely Georgia, Japan, and Thailand, as well as the WHO and the global movement to build stronger health systems for universal health coverage, for organizing this important event. I would like to also thank His Excellency Dr. Tedros, the Director General of the World Health Organization, for being with us here today, as well as Her Excellency, the Deputy Secretary General of the United Nations. Your Excellencies, ladies and gentlemen, since the beginning of the pandemic, we have realized that COVID-19 is not just a health crisis, for it has revealed many socio-economic issues inherent to this era and created many challenges and obstacles to achieve the Sustainable Development Goals. It has also become clear that this crisis represents a major threat to the maintenance of international peace and security, for it increases social unrest and violence, and which in turn would significantly undermine our ability to fight the pandemic. Having realized that this pandemic would not be the last one in this human society, in human history, the Republic of Korea, Canada, Denmark, Sierra Leone, and my country, the state of Qatar, took the initiative in May 2020 to launch the Global Friends of Solidarity for Global Health Security to serve as an informal panel and platform for member states of the United Nations to exchange views on how to effectively respond to COVID-19 and other global health security challenges through multilateral cooperation. Ladies and gentlemen, in this context, the state of Qatar places great importance on health security and universal health coverage in both its local policies as well as its international collaborations. In addition to support initiatives and programs to individual countries, the state of Qatar, represented by the Qatar Fund for Development, signed an agreement with the World Health Organization for a $10 million US dollars contribution to support WHO's 13th General Program of Works and to support the initiatives of speeding access to essential supplies needed in the fight against COVID-19. This supplemented a prior donation of $10 million US dollars to the WHO to support its effort to develop COVID-19 testing equipment, treatment, and vaccines. Similarly, Qatar Airways signed an agreement with UNICEF and COVAX to support the logistics and transport of vaccines across the world. Your Excellencies, ladies and gentlemen, the greatest challenge facing us today could very well be the deepening inequality in access to vaccines, testing, treatment, and necessary healthcare. Herein lies the importance of our meeting today, in which we call for mobilizing political support for providing universal health coverage as part of strategies for response to and recovery from the COVID-19 pandemic. Achieving universal health coverage would contribute significantly to addressing inequalities in health and access. As we get closer to 2023, we affirm our pledge to fulfill the commitments made in the 2019 Political Declaration on Universal Health Coverage and to fast-track the implementation of any and all additional measures required to tackle the global health crisis in order to ensure that no one is left behind as part of achieving the health-related goals and targets of the 2030 Agenda for Sustainable Development. We in the group of friends are willing to provide a platform that allows exchanging expertise and benefiting from lessons and experiences gained in this field. Such platform would better prepare us to face any similar health challenges in the future and contribute to achieving global health security in our time and for future generations. Thank you very much.
Thank you, Minister. Thank you, Qatar, for highlighting the inextricable link between peace, security, and the UHC and global health agenda on behalf of the group of friends of Solidarity for Global Health Security. So thank you, Madam Minister, once again. I would like now to give the floor to His Excellency, Dr. Faisal Sultan, Special Assistant to the Prime Minister and the Ministry of National Health Services, Regulations and Coordination of Pakistan. We will hear from him a video message on how to translate the political vision of UHC into practical steps, including through collaboration on primary health care and health financing under the SDG 3 Global Action Plan. So let's listen to the Minister of Pakistan.
Excellencies, ladies and gentlemen, it is a pleasure today to join you at the UN General Assembly High-Level Universal Healthcare Coverage Side Event. This forum is an important opportunity for us to commemorate the 2-year anniversary of the UHC high-level meeting and to highlight the need for national action and multilateral collaboration through the SDG Action Platform. This platform serves as a very important opportunity to share knowledge and experiences and to identify regional trends and share best practices and lessons learned for sustainable development in health to ensure healthy lives and well-being of our citizens. A joint GAP mission to Pakistan earlier this year has paved the way to strengthen the collaboration among stakeholders regarding PHC for UHC. Pakistan is committed to the Sustainable Agenda of 2030, and in the health sector, UHC is the key policy outcome to ensure progress in health-related goals of providing good health. Pakistan is also committed to the Astana Declaration's renewed focus on health and well-being through a strengthened primary health care, intersectoral policies, and through community empowerment. The National Health Vision for Pakistan provides a well-thought-out strategic framework for implementation of good governance parameters, and these parameters are valuable for achievement of health-level sustainable development goals and universal health coverage targets within Pakistan. The Ministry of National Health Services is thankful to the World Bank and its partners for initiating the dialogue on national health support projects which go from 2022 to 2026 to improve UHC in Pakistan through integrated primary health care with a focus on RM and CH nutrition as well as on infectious diseases and non-communicable diseases. The government of Pakistan is making efforts to enhance allocations and expenditure in the health sector, especially to strengthen and improve community and PHC level services and thus reduce morbidity and mortality of the preventable kind. Along with the private health sector, the government is committed to the provision of essential health services to all. The process of localization of health-related SGT indicators has been completed to meet the set baseline for years 2000 and 2015 and targets until 2030, both at the national and provincial levels. Pakistan has finalized its UHC benefit package, an essential package of health services based on localized evidence and comprehensive consultative processes to transform the national health vision into reality. The government has also started to work on prioritizing intersectoral initiatives while ensuring effective coordination across stakeholders. Public investment in both health and social services can be an important catalyst for positive change, and we believe that improvements in public investment in partnership with the private sector can significantly enhance the efficiency of investment into the health sector of Pakistan. Finally, in order for the world to be on track to achieve SDGs by 2030, a more ambitious and fast-paced implementation is what is needed. We must all stand up with the spirit of cooperation and multilateralism to achieve our common objective. At this moment, global leadership is critical. If leaders commit to building effective health systems that can deliver affordable, and quality healthcare. Only then can we build a healthier and more promising future for our children. In that effort, Pakistan will be a committed partner. Thank you, ladies and gentlemen.
We thank you, Dr. Faisal Sultan, for sharing the experiences of Pakistan on advancing the UHC agenda, especially on aspects of coordination and partnerships, and also for your call for global leadership on global health. Let me now introduce Her Excellency Ms. Wendy Morton, Minister for European Neighborhood and the Americas at the Foreign, Commonwealth and Development Office of the United Kingdom. We will hear from her through a video message on the linkages between universal health coverage and the health security agenda.
It's a great pleasure to be speaking at this timely event, 2 years after the high-level meeting on universal health coverage and the launch of the political declaration, which the UK was proud to endorse. Since the high-level meeting, the world has faced the worst health crisis in recent history. The COVID-19 pandemic has been unprecedented and continues to impact us all in ways we could never have foreseen. Approximately 150 million additional people could have been forced into extreme poverty in 2021. 950 million people are undernourished, and millions of us have lost loved ones. Health systems across the globe have been overwhelmed, with the delivery of essential basic health services severely impacted. Routine child immunisation, for example, has been disrupted in 70% of countries. And the challenge of achieving the Sustainable Development Goals, including universal health coverage, by 2030 has become a whole lot harder, but we must stand strong. The pandemic has given us an opportunity too. It has shone a spotlight on the critical importance of strong health systems, both in achieving UHC and global health security. We do not have to, and should not, choose between these twin aims. We need high-quality, essential health services to support better mental and physical health for everyone, everywhere, without fear of financial hardship. We need health systems with strong, integrated public health functions that combat all forms of malnutrition, deliver effective water, sanitation and hygiene services, and help prevent, detect and respond to local and global health threats. And that's now and in the future. There are only 9 years remaining to achieving the SDGs, including on UHC. Building stronger, more resilient and inclusive health systems must move to the forefront of our collective development efforts as we build back stronger. We must mobilise sufficient sustainable funding that improves access to quality health services for all, reduces financial barriers and provides more health for the money. And the UK remains committed to global health, whether it be ensuring global health security or ending preventable deaths. We believe that a health system strengthening approach is critical to achieving our collective global health goals. And we are developing a health system strengthening position paper and an ending preventable deaths action plan. These will emphasise the importance of building strong, resilient health systems to achieve both global health security and universal health coverage, and how the UK will use our diplomatic, technical and financial resources and research capabilities to achieve these. And we look forward to sharing these with you in due course, so we can continue to align all of our efforts to have the greatest impact for those who need our help the most. Climate change is the greatest global health challenge of the 21st century, and the UK looks forward to hosting the upcoming COP26 summit in Glasgow, which will include health as a strong focus and motivate countries to commit to building their health systems in ways which protect their populations from the impacts of climate change, as well as minimise their impacts on the climate. COVID-19 has been catastrophic to our health and livelihoods. And although we have a way to go, we have an opportunity to hit the restart button. We must invest in strengthening our health systems and prioritise achieving UHC, as well as global health security. COVID has shown us there is no goal more important if we are to live healthy, fulfilling lives.
Thank you. Thank you, Minister Morton, for your message on the critical links between UHC and global health security, preparedness, climate change, and ending preventable deaths. So thank you very much. And now that we have heard from many government officials, committed member states, I would like to turn to other partners who are supporting these efforts to delivering health for all. It is well recognized that we must collectively shift the paradigm to a horizontal, holistic approach to health. Without a foundation of strong health systems, there is no capacity to respond to pandemics, address pervasive diseases, or carry out routine functions such as immunization. Investments in universal health coverage have far-reaching impacts across the health spectrum, which is why we must work together towards this common goal. So first, I'd like to draw your attention to a video of the SDG 3 Global Action Plan Principles Group, highlighting the collaborative work of the 13 agencies of the United Nations that are in their efforts to enhance the UHC agenda. So let's watch the video.
The Global Action Plan for Healthy Lives and Wellbeing for All, SDG 3 GAP, aims to improve the collaboration of 13 agencies across the multilateral system to support an equitable and resilient recovery from the pandemic and drive progress towards the health-related SDGs.
Our aim remains stronger collaboration for better health.
The SDG 3 GAP was born at a time as we gained a deeper understanding of our need for it before COVID-19 hit.
We were already lagging, with at least half the world's population still unable to access essential health services. We thought, surely we can do better.
It's 2021, and we are not only further off track in achieving the SDGs, but for the first time since their adoption in 2015, progress on the goals has been reversed.
We are supporting countries in a world where inequalities are growing and inequities persist.
COVID-19 has exacerbated existing inequalities across all aspects of life for women and girls.
Now, more than ever, as we fight COVID-19 and protect hard-fought gains made in global health, we need massive and cohesive global investments in health.
The accomplishments of the SDG 3 GAP so far are encouraging, but implementation needs to be expanded further.
Country-level implementation has increased to 37 countries, with many prioritizing primary healthcare reforms.
Our work in Primary Healthcare Accelerator supports government and civil society partners to implement national and subnational work plans. This includes working alongside other partners to provide essential supplies, data, digital health solutions, and other innovations, even in fragile and complex environments.
And in Pakistan, coordinated sustainable financing and efforts to boost the primary healthcare system is paving the way to universal health coverage.
In Côte d'Ivoire, we worked with the Ministry of Health and civil society organizations to support a primary health budget increase of 15% every year.
As part of the ACT Accelerator and with partners, UNITED is leading the work on therapeutics and also access to oxygen in low and middle-income countries. This work is fully complementary to the work of the GAP to increase oxygen supply in countries.
On innovation, WHO and partners helped to scale solar-powered oxygen in Somalia.
In countries like Malawi and Nepal, we work with partners like the Health Data Collaborative. That is strengthening data sources so that countries can assess how they're performing against the SDG health targets.
UN Women, together with the UN University's Gender and Health Hub and key gender working group members, have jointly developed a guidance note. The guidance provides very practical actions that decision makers can take to promote gender equality, and ensure an equitable uptake of COVID-19 vaccines by leaving no one behind.
It has spurred the development of a new global dashboard for vaccine equity. To give you one example, the dashboard empowers governments, policymakers and other partners with the very best of data and analytics to accelerate universal access to vaccines.
To align across health partnerships, we're integrating work under the Every Woman, Every Child initiative.
We continue to learn and adapt, to look for opportunities to innovate, and to work smarter in supporting countries to achieve their health-related targets.
With countries in the lead, our collective efforts under the GAP are already helping deliver concrete results across health systems while building more resilient health financing strategies focusing on equity.
When we collaborate, stronger collaboration, that means better health.
Our goals for the next years are to at least double the number of countries in which we're working, to roll out the monitoring framework to optimize our support to and measure our impact in countries, and to continue to jointly support countries to strengthen primary health care.
Together.
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 For an equitable and resilient recovery.
Wow. Wow, wow, wow. Truly powerful. It's touching and encouraging to see the whole UN family working together to ensure health for all, one UN for UHC. So we can all meet SDG number 3 and beyond. If you allow me, I would like now to introduce a video from the Coalition of Partnerships for Universal Health Coverage and Global Health from the Global Health Principles Group. The video is going to show on the how to align the UHC agenda and disease-specific agendas. I have to say that the coalition just recently published an op-ed yesterday. The article link is available in our chat function in the Zoom. And don't forget that we have a Q&A facility that you can use so your questions can be answered by our experts. So please, let's share this video on the Coalition of Partnerships for UHC and Global Health Principles Group. In September 2019, at the United Nations high-level meeting, world leaders endorsed the most ambitious and comprehensive political declaration on health in history.
The next meeting in 2023 will be a significant opportunity for heads of state to reaffirm their commitment and to recognize the role of universal health coverage as an overarching umbrella for Sustainable Development Goal 3.
Therefore, a group of health partnerships are establishing the Coalition of Partnerships for Universal Health Coverage and Global Health.
Achieving universal health coverage is the key to making meaningful progress for all areas of health. If access to quality, affordable services is universal, people affected or at risk of diseases will be able to get the services they need to live a healthy life without suffering financial hardship.
That's why we should unite under a common health goal.
Recognizing the need for greater collaboration and harmonizing across health programs, the coalition brings partnership to align advocacy and accountability efforts.
In too many countries, health services are poorly funded by public resources. As a result, people struggle to access necessary health services or are forced to pay for them out of pocket.
Universal health coverage encourages governments to deliver services based on the principles of the human rights, equity, and need. Because when we can close gaps and improve coverage across wider population, we free up limited resources for more targeted health programs.
Rather than working in silos, we are coming together to promote comprehensive, people-centered care that leaves no one behind.
In the coming years, we will work together to promote socio-political accountability mechanisms that are inclusive, evidence-based and country-led, to increase and improve coordination among the various health initiatives, and to strengthen existing accountability mechanisms for the Sustainable Development Goals.
We are thrilled to embark on this journey together. Let's work together towards good health and well-being for all.
Universal health coverage
leaves no one behind.
Okay, wonderful, wonderful, much needed alignment and coherence of disease-specific agendas and UHC. The takeaway of this message, UHC leaves no one behind. So let's work together towards good health and well-being for all. And now I will if you allow me, to turn to our esteemed panel of experts who have joined us today for a conversation on the impact of the 2019 political declaration on UHC and how to make the next high-level meeting as strategic and impactful as possible. So basically, I will turn to Gabriela Cuevas Barron, our UHC 2030 Steering Committee co-chair, and I would ask her this question, which is a common sense question, but of course, COVID-19, as we heard, has been a stress test to our health systems and has significantly hindered UHC progress. So how would you reframe the UHC agenda's strategic priorities and reforms in the context of the current and public health emergency? So the floor is yours, Madam Co-Chair of UHC at 2030.
Thank you very much, and thank you for the invitation. We have heard it before. COVID-19 has revealed the structural inequalities and major gaps and weaknesses in our health systems and social safety nets. To strengthen our health systems, we must focus on equity and resilience, including for all COVID-19 response and recovery strategies. Specifically, we need to focus on addressing gender inequalities, meeting the needs of vulnerable groups, and ensuring equitable access to vaccines, treatment, and diagnostics. By strengthening the resilience of health systems, we can mitigate, prepare, respond, and recover from crises while maintaining the provision of essential public health functions and health services. This is crucial for UHC and health security goals, as well as for wider socioeconomic progress. There is also a renewed sense of urgency due to the pandemic. Although all countries committed to achieving UHC by 2030 in the last political declaration, we can no longer afford to wait that long. If we wish to reinforce our response to the pandemic and protect everyone from future crises, we must accelerate our efforts to advance UHC together with emergency preparedness. COVID-19 has reminded us that primary healthcare is our first line of defense and response. To keep people safe and healthy, world leaders must strengthen health service delivery, essential public health functions, and emergency risk management. And most importantly, they must empower communities to decide their health. Finally, we are in the middle of a pivotal moment, and we have an opportunity and a responsibility to invest efficiently in strong health systems that protect everyone. We can do so by ensuring action on two system shifts, investments and integration. This means ensuring more and better aligned resources for health systems based on primary healthcare approach that reinforces health service delivery, essential public health functions and emergency risk management, while considering the system as a whole. The next UN high-level meeting will be a significant opportunity to take stock of our progress and setbacks during the pandemic and set into motion concrete actions to invest in more resilient and equitable health systems that leave no one behind in peacetime and in emergency situations.
Thank you, Madam Co-Chair of the UHC 2030 movement. I will come back to you with yet another question, but let me now turn to Emilia Saiz, Secretary General of United Cities and Local Governments, UCLG. We have all seen local government leaders, governors, mayors, being at the front line, protecting people in the current pandemic. So how can the global community support their efforts to translate UHC commitments into local actions? The floor is yours, Emilia.
Thank you very much, Chair, and thank you to all the partners that have made this possible. I am delighted to be part of the UHC 2030 Political Advisory Panel and to participate in this discussion. A straightforward answer, María Fernanda. Their role needs to be acknowledged. The role of mayors and governors around the world is not really acknowledged around the health sector, because probably the problem that we face is that in very few discussions, health is understood beyond healthcare and the health sector. Dr. Tedros has said it. This is an all of government, all of society effort. And at the core of that all of society effort, you find local governments, local investment, local public service delivery. The international community needs to support this vision. And healthcare and the roles that local governments play in healthcare needs to be understood beyond emergency. Everybody has discovered it now around emergency, but the decisions that are taken in cities, in territories, affect us beyond the emergencies. We will not be ready, we will not be resilient unless our cities are designed in a way that favors good conditions, health, that help, unless our citizens are fed in a proper way that guarantees our immune system receiving immunity, we will not be able to deliver vaccination unless our territories are and the infrastructure is connected, and so forth and so forth. And we are suffering from lack of investment, which is critical, but also from that connected vision of the local service provision and the relationship with healthcare. And I think if we all start to look at health from the perspective of universal coverage, and we all understand that waste management, water management, public transportation, public spaces are closely related to the way we experience health and how healthy we are, then we will be changing the conversation. And the kind of exchange that we are having here is extremely critical to do that. The World Health Organization is doing a great job at opening up a lot of spaces in relation to emergency, but I think we need to go beyond that, and that's why my organization is so happy to be part of this discussion. It's beyond emergency. It's about public service delivery at the core of healthcare.
Thank you, Emilia. Loud and clear, we heard from Gabriela the sense of urgency, speedy immunization, gender equality, empowerment of communities, co-responsibility, investment in strong health system. And now we hear from you, the key word of what you said is acknowledgement of the critical role of local governments, local leaders in UHC, and ensuring a public service delivery. And it is not only about responding to the emergency, but it's an all-encompassing structural shift that that's exactly what we need. So thank you very much to you both. And of course, I now have the pleasure to give the floor to Ana María Béjar, Director of Advocacy International, Planned Parenthood Federation, and CSEM Advisory Group member. So Ana María, the question to you would be, how does civil society can hold governments accountable for their 2019 UHC commitments. So please share what you are doing since 2019 as a voice from civil society. The floor is yours, Ana María.
Thank you very much, María Fernanda, and thank you for the organizers to this high-level event, and especially for the invitation. Just a quick presentation of the Civil Society Engagement Mechanism, CSEM, of the UHC 2030 Partnership. We have over 1,000 members who all of them work in country accountability. And we strongly believe that strong health systems need transparent and accountable governance, which must include communities and civil society in every step of the decision making, not as an add-on, but from the beginning. And of course, universal health coverage is even more critical in times of pandemics. We have done a lot. And I would say that from the beginning, from the very initial stages of the political declaration in 2019, we worked together with you governments to really make sure that UHC honor the U, which is the universality of services, including sexual and reproductive health and rights, and including also gender equality very strongly in a human rights framework. So just to give you, as we say in Spanish, para muestra basta un botón, it's just an example that today the COVID-19 sex disaggregated data tracker was published, and only 16 countries have disaggregated data by sex on testing on COVID. Only 11 countries on confirmed cases among health workers, and we know that 70% of the health workforce is female. So we have a long way to go. At CSEM, early in the pandemic, we released a COVID-19 response survey results, which are included in an article of the British Medical Journal. The main message of that survey was that civil society was not involved in almost any of the COVID-19 response strategies, meaning we are not part of the commissions at the national level. And that was not very different from what's happening before COVID. So our main message here is please engage us, please call us, and not only call civil society, but women from civil society and women from the communities left behind. As a response to this survey, we also use that information to collaborate with our research. And we are co-authors of the recently launched Handbook on Social Participation for UHC. This is written for governments. And also we are led civil society country consultations in about 20 countries worldwide to discuss UHC gaps that exist in each country and what governments and stakeholders can do to fill those gaps. And that was a contribution and keep being a contribution for the state of the UHC commitment report. Very briefly to finish, some country examples that are really inspiring of disability advocacy groups working in India and Asia Pacific to work with local governments actually to set up free of cost online health consultations, accessible toll-free helplines for them. In Tunisia, for instance, we saw the Tunisian government calling a very broad spectrum of actors, including civil society, to relaunch the national health law in order to address the challenges of COVID. And now, as a result of that national health policy, for which the Universal Health Coverage Declaration of 2019 was an inspiration, we have the Tunisian government providing services for free to LGBT communities, to refugees and migrants. We have also some very sad examples of some governments, like the UK government, unfortunately, reducing their overseas development assistance from 0.7% to 0.5%. But our message includes civil society. This cannot be an afterthought for strong health systems. And we are the ones who are together with the communities who are, from the lived experiences, have the consequences of health reforms.
Thank you, Ana María. Thank you, and you are right. More space for civil society, for women, especially women that are left behind. You need to be part of the decision-making table. You provided several examples of why it is so important. Let me go back to you, to the three of you, with one question, the same question to the three of you. And I saw Emilia raising her hand. Just a headline of what would be your dream, your expectations for the 2023 high-level meeting on UHC. What is the phrase you would like to see there in the political declaration as a follow-up to the 2019 political declaration? 1 minute, please, because I'm told by the organizers that we're running out of time. So please, 1 minute, Gabriela, the floor is yours.
Thank you so much. As we played a unique role in the last high-level meeting to consolidate diverse voices of the UHC movement, UHC 2030 will continue contributing to the preparation of the meeting and its political declaration with our multi-stakeholder partners. We will stimulate public dialogue around UHC Day every December and prepare a clear set of key asks for the next political declaration. UHC 2030 will also work closely with the new established coalition of partnerships for UHC and global health to unite health leaders and advocates in a common goal. UHC 2030 will also support social accountability approach through the State of UHC commitment. The review is published annually before UHC Day to provide a multi-stakeholder view on the state of global and country commitments towards UHC. To prepare this year's review, we are currently collecting UHC stories from individuals and communities until 31 October 2021. So please submit your stories. UHC is about, yes, leave no one behind, but of course to bring everyone on board. Thank you so much.
Thank you, Gabriela. Very clear. We need a multi-stakeholder approach, and we need better monitoring and accountability mechanisms. That is crystal clear. Now I give the floor to Emilia. Emilia, what would be your answer?
Thank you very much. I was giving a thumbs up to Ana María, actually, for holding all levels of government accountable and asking us for transparency, and local governments need to be there. And now my ask is for the declaration and the high-level meeting to call national governments to develop subnational plans that strengthen local service provision, and local service provision at the heart of the recovery reset plans. That's my ask.
I of course cannot agree more with you, Emilia. Absolutely. The ask is subnational plans and strengthening the local service provision mechanisms and investment, of course. So let me now, I go to the questions and answers. We have been, I would like to briefly open the floor for interventions. We have already, several requests for the floor. Very, very quickly, 1 minute intervention, so we can listen to as many partners as possible.
María Fernanda, can I yes,
left you. I need to say, apologies.
No problem. My constituency is going to kill me if I don't say this. We would like a good assessment of what happened and then work at the country level. We have just published an amazing Health for All Advocacy Toolkit addressed to national advocates and subnational advocates. Thank you very much, Emilia. Please go online, please download it. We're going to launch it the 7th of October. And our dream is to really bring the voices at the country level, at the community level, to get to the next stage and to bring women and everybody who is left behind with us. Thank you.
Thank you. Thank you to the CSCM. Incredible work. Ana María, apologies again. No, I was rushing a little bit because we are running out of time, but thank you so much for your great work. And please do go and click into the link that was just shared. So I would like now to give the floor to Dr. Emmanuel Ankara Odame. He's Director of Policy Planning, Monitoring and Evaluation of the Ministry of Health of Ghana. You have the floor.
Thank you, Madam Chair, for this opportunity. Ghana, in its universal health coverage roadmap, has defined universal health coverage as all people in Ghana having timely access to high-quality health services, irrespective of the ability to pay at the point of use. And we've identified fully the Global Action Plan for Healthy Lives and Wellbeing on its key pillars: engage, accelerate, align, and account. Clearly, the lessons of COVID has taught us that the lessons of the future has to be around the values that we need, our agility and fast responsiveness. And we've realized that we never need to waste a crisis. This led us to embark on a massive infrastructure drive to provide 101 district hospitals in deprived places, with the government has termed Agenda 111. Ghana has also set up to establish a National Vaccine Institute to coordinate domestic development and manufacture of vaccines. And this is in line with our Ghana Beyond Aid agenda. As the 21st century is the age of design, we call on the United Nations to encourage member states to re-examine the design of their health systems in terms of systems, environment, and processes. This, we believe, will provide the right architecture to achieve universal health coverage. UAC 2030's contribution was very valuable for member states to prepare during the last political declaration in 2019. And Ghana welcomes UAC 2030's continued support to member states and other multi-stakeholders towards 2023. Ghana also appreciates the UAC movement political advisory panel's efforts to support political advocacy of the UAC movement in critical milestones towards 2023. Thank you.
I thank you, Dr. Emmanuel Ankare Odame from the Ministry of Health of Ghana for your contributions to this dialogue. Let me turn immediately to Ms. Florine Clomega, Deputy Regional Director of Africa of IFRC. You have the floor. Remember, we are running out of time, so just a minute to share your thoughts or ask any question to our panelists. You have the floor, Ms. Florine Clomega.
Your Excellencies, this discussion today on universal health coverage is a crucial one, as we at the International Federation of the Red Cross and Red Crescent Society, through the network of our members' national societies, see the impact of every day of the COVID-19 pandemic on people. Our national society are present in 54 countries, 192 globally, and we see every day that the fight against COVID-19 is taking a toll. In the past years, IFRC has taken a prominent role in the process leading up to the UN National General Assembly high-level meeting on universal healthcare. We've seen the reason now the following. Firstly, we need a real humanitarian need to help people. Secondly, we strongly believe that our national society and community health volunteers are essential in achieving universal health care. Lastly, we believe that the momentum toward universal health coverage provides an ideal platform for a national society to engage in the health ministry and strengthen the health services. Our strength as a network is our presence at the local, community, and national level, where we are present on the front line of disaster response and policymaking. We have a network of community health-based worker and volunteer. We have a proven and a parallel advantage to lead on anticipatory actions for prevention and early action to mitigate disaster impact and effectively respond to disaster, public health emergencies, and conflict whenever they occur. So to operationalize our vision on strengthening universal health coverage, as an example, our Secretary General led on the signing of a partnership with Africa CDC, where both institutions have committed to strengthen investment in local level actions and to strengthen community resilience to public health emergencies. Our commitment to universal health coverage is evident in this COVID-19 pandemic. National Red Cross societies across Africa have remained on the front line of the response of COVID-19, but also of other disasters like flood, drought impact, locust invasion, and everywhere they were present. They provided ambulance services, conducted tracing, and so on. And they also tackled the stigma and the spread of misinformation. So the Red Cross and Red Crescent societies are committed to help and deliver humanitarian assistance wherever it's needed and to make a difference in the life of the people we serve.
Thank you so much, Florine Clomega. from the International Federation of the Red Cross, and thank you for bringing this connection between disasters, conflict, humanitarian needs, and UHC, and the need to build resilience and preparedness. So thank you very much for that. I would immediately turn to Dr. Poonam Dhawan, Senior Migration Health Policy Advisor of the IOM. You have the floor.
Excellencies, distinguished participants, the International Organization for Migration thanks you for the very insightful messages shared here today and remains a committed partner on the road to 2030. The 2019 UHC Political Declaration had rightly called upon us all to address the particular needs of migrants, refugees, and internally displaced persons. Entering the SDGs Decade of Action in the midst of the public health, human mobility, and socio-economic crises of the COVID-19 pandemic has made the principles of UHC and the aim of leaving no migrant behind even more urgent. Let us recall that being inclusive is not just the right thing to do, it is also the smart thing to do. That stigma and discrimination have no place in health systems, and that people on the move are a critical part of the solutions, including for sustainable recovery from the pandemic for all. I thank you.
Thank you, Dr. Dhawan, and also thank you for making the connection between health for all, universal health coverage, and people in mobility. It is of extreme importance that the right to health is also guaranteed to the people in mobility situations, and absolutely. So I think that the partnership with IOM is highly valued. I would like now to turn to Dr. Cesar Núñez, Director of UNAIDS of the New York office. You have the floor, Dr. Núñez.
Muchas gracias, Madam Moderator. UNAIDS is pleased to be part of discussions for the preparations of the 2023 UHC-HLM. Now more than ever, the world needs universal health coverage to protect everyone and to better respond to health emergencies. Allow me to underscore the U in UHC and then stress three main points. Number one, ending inequalities that hinder a person's ability to access health services. Reaching the furthest behind first will require addressing the structural and social determinants of inequality to be addressed. That includes intersecting factors like one's social economic status, gender, age, race, sexual orientation, and gender identity, disability or migration status, as has been mentioned, or whether one is subject to human rights violations or sexual and gender-based violence. Number two, building strong and resilient systems for health that put people at the center and take the human rights-based approach. Age, gender-blind approaches that neglect the sexual and reproductive health and rights of women, adolescents, and LGBTQI must end. Stigma, discrimination, and criminal laws that prevent people living with HIV and key populations from accessing services must be eliminated. We also need quality and affordable essential health services to include, among others, services for HIV and SRHR. Three, ensuring the critical role of communities, as has been underscored during this session. 40 years of AIDS response and the recent COVID-19 pandemic demonstrate that responses led by and for communities are more effective. There is urgent need for their full integration into national health and social systems with long-term sustainable financing, which is critical. As a co-lead for the SDG 3 GAP Community Engagement Accelerator, UNAIDS is pleased to support civil society and community consultations, which contribute to their participation in UHC processes in countries in partnership with UHC 2030, CSEM, IFRC, and other groups. Let me conclude, Madam, by noting UNAIDS support for the better linkages between the health-related issues and joint advocacy for the implementation of the political declarations across health-related high-level meetings. Together, we are stronger. Thank you.
And yes, indeed, Dr. Núñez, together we are stronger. And thank you for also contributing and bringing to the table the issue of inequalities, of access, of the need to addressing the underlying causes of and the transactional inequalities that hinder the fulfillment of the right to health and UHC. So thank you very much. before we close, because I don't think we have space, unfortunately, for the request for the floor that we have received. I think I see a hand raised from Ana María Béjar. I don't know, Ana María, if you would like to take the floor.
Yes, it's just to say thank you very much, and that some of the questions on the chat are really important, including, as Cesar said, the mention of the participation of key populations and the left behind. That's all, and thank you very much. I hope this is the start of this road that we are going to do together.
Absolutely, and we have to walk together, absolutely. So I would like to really close by thanking our guests, panelists, partners, for their incredible contributions to today's discussion, and for continuing to engage in the conversation over the next 2 years, so we can together accelerate targeted actions that we've identified today as we prepare for the UHC 2023 high-level meeting. So basically, what we heard today is the need to translate policy into action, support implementation. We need resilient and equitable health systems for the future challenges. We need to strengthen primary healthcare, collaboration, coordination, solidarity at the global level, the need for further involvement of civil society and local governments. As subnational governments are absolutely critical. Gender equality and addressing both vertical and horizontal inequalities. UHC is about leaving no one behind, and that is absolutely true, leaving no one behind in the health sector. So once again, thank you again to all of you. I would only like to remind our guests that International UHC Day is in December 12th. Is a key moment for us to continue our advocacy efforts. So we invite everyone, all our partners, to participate in this year's campaign. So materials and information is available on the UHC Day website, and it has also, as I understand, been posted on our chat function. I can only say thank you, thank you, thank you. And I really hope that we will see you all very, very soon. We have a 2 year of collective homework to do for the next UHC high-level meeting. So thank you again. Thank you for your commitment and partnership. So see you very soon.
Thank you.
Thank you, moderator. Outstanding.
Excellent.
Thank you.
Thank you very much.
Thank you, everybody.
Thank you.